Hi, I'm Brent Stafford, and this is RegWatch by RegulatorWatch.com. In public health, trust is supposed to be sacred. For decades, tobacco control defined and promoted the truth about combustible tobacco. Cigarettes kill, nicotine is addictive, and the only path forward is to quit or die. But that truth, once necessary and urgent, has hardened into dogma. It no longer reflects the science, the evidence, or the lived experience of millions who quit smoking thanks to vaping and other safer nicotine products. In every way, these products challenge and interrupt tobacco control's monopoly on truth. Joining us today to unpack these issues is Dr. Jeff Willett, Vice President of Strategic Engagement at Global Action to End Smoking. Dr. Willett is a 25-year veteran of the tobacco control movement. He's held senior leadership positions at the American Heart Association, the Truth Initiative, the New York State Tobacco Control Program, and the Ohio Tobacco Prevention Foundation. A sociologist by training, Dr. Willett is a respected public health leader, now speaking up for tobacco harm reduction. Dr. Willett, thanks for joining us today on RegWatch.
Thanks, Brent. It's great to be here.
So let's start off then at the top with tobacco harm reduction. Many within tobacco control are skeptical, maybe even a little hostile towards THR. Why do you support it?
Well, quite simply, we know that most people who smoke want to quit, and roughly half of smokers today are going to try to quit in the next year. And with traditional public health approaches and tobacco control approaches, far too many of them won't be able to quit successfully. So I've been in tobacco control for 25 years. I've recognized that the existing tobacco control smoking cessation strategies are insufficient to meet the need. I also appreciate the science that's emerged around e-cigarettes and the role that they can play in cessation. Tobacco harm reduction is supported by the evidence. We now have, the well-respected Cochrane review that's concluded on multiple occasions, but most recently concluded that e-cigarettes are even more effective than NRT at helping people quit. I think the Cochrane review cited over 40 randomized clinical control trials that were used to establish that. But we also see what's happening in the real world. So in the United States, we're seeing that people are able to quit using e-cigarettes, transitioning completely away from combustible cigarette use. To exclusive e-cigarette use. Many are quitting nicotine entirely through the support of e-cigarettes. I think in the latest MMWR from the CDC, it showed that in a 6-year period, the last 6 years, there are 7 million fewer exclusive cigarette smokers in the US. And over that time, there are roughly 7 million more exclusive e-cigarette users in the US among adults. So clearly we're seeing, that transition occur in the real world. And again, cigarette smoking is the leading preventable cause of death. That should be the focus of every tobacco control practitioner. How can we quickly and equitably reduce cigarette smoking to save lives?
Do we know how many Americans actually use e-cigarettes?
I think the current estimate is around 18 million American adults are using e-cigarettes. I think there's roughly 26 million adults who are still smoking combustible cigarettes. So we're talking about millions of people. When you look at cigarettes and how many people are still smoking, millions of people who need our help.
So those millions that have made the switch, not all of them have completely switched, but we can argue about dual use later. But certainly, though, they voted with their feet, so to speak. So why is it then that tobacco harm reduction is so controversial with inside public health?
Well, and that's interesting. If you think about it, tobacco harm reduction is actually integral when you look at clinical practice guidelines around tobacco dependence treatment. So the use of medicinal nicotine replacement products is a form of harm reduction, right? We're working with adults who are smoking cigarettes, and clinical practice guidelines would indicate that if those individuals were to use a patch, use a gum, use lozenge to help them taper down and quit cigarette smoking, that's actually best practice. That's a form of harm reduction. It's shifting people to a lower risk nicotine delivery product. Where it becomes controversial is the non-medicinal nicotine products. And that's when industry is involved, the tobacco industry, entrepreneurs who are developing e-cigarettes, the whole landscape with regard to the reduced risk products. Now that is, that's entering into the field of industry developed products rather than medicinal products. So that's where the controversy lies. I think, why is it so controversial? Just decades of mistrust of the tobacco industry, all warranted when you look at the early days of the tobacco industry. And that's really the issue that is disrupting, I think, acknowledgement that tobacco harm reduction can be scaled up beyond the medicinal NRT products to these lower risk products that are effective at helping people quit.
Dr. Willett, please share with our viewers a bit about where you're from and what brought you into the tobacco control space.
Sure. I'm from America's heartland. I grew up in the state of Nebraska. I was working on my PhD in sociology at the University of Nebraska when I kind of fell into a full-time position evaluating the Tobacco-Free Nebraska program. So at the time that I got into tobacco control, high school smoking rates were 25% in the US. And there was a lot of hope and optimism with the Tobacco Master Settlement Agreement, a lot of hope and optimism that we would be able to quickly reduce youth cigarette use and also help millions of people quit smoking through an investment in tobacco control and an investment in tobacco cessation. I fell in love with public health because of the applied aspects of the work. I was completely on an academic path before I got that job. But I just fell in love in the real world impact. I have family history with cigarette smoking and just have always been passionate about this issue, particularly passionate about helping people who want to quit smoking be successful. So that love affair with tobacco control while I was finishing my doctorate either blessed or cursed me with kind of a lifetime of work in the tobacco control movement.
So you recently reflected on your early years at the Ohio Tobacco Prevention Foundation. I think it was an article you released on LinkedIn in March, and you talked about its tragic demise. So remind our audience, you just mentioned it, what is the MSA and what kind of happened with those dollars that affected you in that program?
Sure. The Tobacco Master Settlement Agreement was an agreement between the major tobacco companies, the leading cigarette manufacturers in, I think, 46 states. The agreement was designed to compensate the states for smoking-related illness and death. So through the agreement, each state that was a participant in the Master Settlement Agreement got an annual payment that was based on the current rate of smoking in the state. The Master Settlement Agreement also established the Truth Initiative. I think there was $1 billion from the Master Settlement Agreement that went to establish the Truth Initiative. So the Ohio Tobacco Prevention Foundation was the entity that the state of Ohio created to manage Master Settlement Agreement funds in that state to implement a comprehensive tobacco control program. The original plan was that foundation would get $1 billion from Ohio's share of the MSA. I joined the foundation around a point where the state had revised that commitment. and decided to kind of suspend the MSA payments to around $350 million to the foundation. That's still a considerable amount of money. And we used that money to implement a very robust and comprehensive tobacco control program in the state. At the time, Ohio had the third largest tobacco control program in the country based on annual funding behind California and New York. And one of the hallmarks of our approach was what we called Ohio Quits. And Ohio Quits was an integrated network of smoking cessation programs that included hospital-based, tobacco dependence treatment clinics, kind of what we saw as the gold standard for treatment. It included our state quit line. It included web-based components. It included community quit programs that were culturally tailored, culturally relevant to people. So really had a wonderful program that was up and running, and the state decided to reappropriate those funds, move them into the general revenue fund. And so, what was a very, very important commitment that Ohio made was changed, and the incredible potential of that foundation ended very surprisingly and abruptly, unfortunately.
So Ohio isn't the only state that's done that, appropriated those funds for general revenue. So not helping smokers try to quit in that state. But also some states have actually borrowed against those annual payments in the future and have already spent the money. And so they're really hoping that they still get that MSA money every month, every year. So does that not put some of these states in business with big tobacco?
Well, I don't know if I'd go that far. Ohio is one of those states that securitized their MSA payments. So they took a lump sum for a certain number of future MSA payments. And if rates of smoking decline to a certain point, then the state's kind of underwater with regard to that, and may actually owe the investors who bought future payments to make up for whatever the lost revenue was. The Campaign for Tobacco-Free Kids refers to this as broken promises. They have a broken promises report that they issue every year that talks about the fact that states have not used tobacco master settlement agreement funds and cigarette tax revenues to adequately help people quit and to implement comprehensive tobacco control programs. So that's part of the challenge with tobacco control is that there's plenty of revenue. There's plenty of tobacco generated revenue through the MSA and through cigarette tax revenues that goes to state and federal government. The problem is that very little of that is actually invested in programs designed to help people quit.
So let me just bring this up because you frankly are the only person that we've talked to in 10 years from tobacco control that's willing to address this MSA issue. And just the last point I want to make on this is that some of the more darker and suspicious members of our audience, me included, thinks that this is a disincentive for some states to encourage people to quit smoking. Like maybe could be one of the reasons why there's been such hostility towards nicotine vaping from the very start.
I certainly recognize that if there is to be a much more rapid reduction in cigarette smoking in the United States, the loss of cigarette tax revenue and the related loss of MSA payments would reduce state government tobacco revenue by billions of dollars. And what I would say from my perspective is that public health hasn't been doing enough to prepare policymakers for that, and for policymakers to recognize that that is a good thing. That would be a good thing, that we do need to accelerate the reduction in cigarette smoking, and that there will be a short-term cost, but a long-term benefit to that. So I don't know that there's really a dark conspiracy related to that, but I do know that there are two forms of addiction when it comes to tobacco. There's nicotine, and then there's government dependency on tobacco-generated revenue. And it's up to public health to address both forms of addiction.
let's dive back into a little bit more on your background. You've worked in tobacco control at some high-powered nonprofits, the American Heart Association, the Truth Initiative. Tell us about that. What did you work on?
Sure. I joined the Truth Initiative shortly after David Abrams and Ray Nyara, who many of your viewers will know, left the Truth Initiative. Several of their team members also left Truth at that time. So, I worked to rebuild a health policy research institute within the Schroeder Institute, a health policy research team within the Schroeder Institute. One of the first studies that I did was looking at youth use of Juul. I think I had one of the first peer-reviewed studies that estimated Juul use among young people. I also thought a lot about the potential risks and benefits of e-cigarettes from a public health standpoint. That culminated in an opinion piece that Robin Koval, the president and CEO of the Truth Initiative, and I, published in JAMA that was titled "The Potential Risks and Benefits of High Nicotine E-Cigarettes." And in that paper, we acknowledged that e-cigarettes very likely can play a really important role for adults with smoking cessation, but we were concerned about youth use and youth uptake. And the key question is, what's the balance? Where do we balance the risks and benefits from a public health standpoint? So, that's really been something that I've thought about ever since. And that's what I think that, that we need to strive for in public health, is finding that balance. But I went from the Truth Initiative to the American Heart Association, where for about 6.5 years, I supported the AHA's organization-wide strategies related to tobacco and nicotine. So I helped lead and direct some of these efforts. I helped support some. I was just kept aware of some others. But generally, I was probably the one person at AHA during that time who had at least a general awareness of everything that we were doing across the tobacco and nicotine space. During my tenure there, I worked on a lot of projects. I'll just talk about a couple that I'm proud of, that I thought were, really great opportunities for the Heart Association. One was a grant-funded initiative where we worked with school districts across the United States to implement supportive disciplinary responses when students were caught using e-cigarettes. So I think one thing maybe your viewers, or some of your viewers don't appreciate, is just how focused schools were on e-cigarettes 2018, 19, 20, 21, and how really there was a lot of disruption created with that issue. And far too many school districts responded with harsh disciplinary practices, suspending kids, expelling kids, taking away extracurriculars, referring students to law enforcement.
Taking doors off the bathrooms.
Taking doors off the bathrooms, exactly. So we worked with school districts to implement more supportive approaches. Have a conversation with the student, discourage their use, perhaps point them toward a prevention or cessation program. But whatever you do, keep them in the classroom and don't refer them to law enforcement. So that was one initiative that I supported. During my time at AHA, I championed the AHA's tobacco endgame position, which is basically first end the use of all combustible tobacco products while ensuring the next generation isn't addicted to nicotine. So it's kind of those two parts, but first end the use of all combustible tobacco products. And, in my dream scenario at AHA, I would have led efforts to operationalize exactly what that would look like. How would we optimally quickly and equitably end the use of combustible tobacco products, in the United States. So those were my experiences with Truth and the American Heart Association.
Well, let me ask you, and I hope that this is a fair question. I mean, at the time, was the American Heart Association on record as being anti-vaping, or for the lack of a better word, or very cautionary, I guess? And what about Truth Initiative? Because my recollection was that there wasn't a lot of support for vaping from those organizations.
Yeah, I mean, I think the Truth Initiative, while I was there, and really those thoughts are best, I think, presented in the 2018 JAMA piece that Robin Koval, Jody Briggs, and I wrote. Again, there are risks and benefits of these products, and the trick is to figure out how, from a public health standpoint, we really maximize the public health benefits for adults while ensuring, there's not a whole lot of collateral damage, so to speak, among young people. With the American Heart Association, the focus was on youth primarily, like you and many of your guests have talked about. There's an emphasis on youth prevention. There's not been as much of an emphasis on adults and smoking cessation. So that was certainly the case at AHA. I mean, we also certainly did things that were helpful for adults and certainly focused on smoking cessation. I would say certainly the emphasis has been on youth or was on youth. And again, this is 2019, 2020. Youth e-cigarette use was peaking, was alarming a lot of people. That became a focal point for a lot of tobacco control for sure.
Dr. Willett, has misinformation shaped the public's understanding of safer nicotine products? And if so, how so?
That's a great question. There's certainly a lot of misunderstanding regarding nicotine. And, kind of in the intro, you mentioned how over the decades, the message was pretty simple. Cigarettes are deadly and nicotine is addictive. And those two were tied together, right, for many years. So a lot of misunderstanding emerged where people overestimated the health effects of nicotine. We know that the majority of physicians in the United States and around the world believe that nicotine causes cancer. That's the case in the public, among policymakers, among people who use tobacco products. That misunderstanding is there. I've never been part of a meeting at the American Heart Association or with other public health partners where we said, we need a misinformation campaign. We need to develop stuff that misinforms people. However, what I saw was that there was not an appreciation for the emerging science around e-cigarettes and reduced risk products. There was not an acknowledgement of the very strong science and evidence that's emerging regarding the potential role that e-cigarettes have in helping people quit smoking. There was no adjustment being made to acknowledge the continuum of risk for nicotine products and how to basically be a little bit more nuanced and sophisticated with approaches in ways that would both prevent youth use as well as accelerate adult smoking cessation. One example that I would provide, kind of how things evolved in the tobacco control space and within the American Heart Association, AHA had Life's Simple 7 behaviors that are related to heart health. And in Life Simple 7, cigarette smoking was one of the factors, right? That makes sense. You and I would agree that cigarette smoking is certainly related to cardiovascular health. Well, AHA revised that framework, added sleep into the mix, and launched Life's Essential 8. And cigarette smoking evolved into nicotine exposure. So there was clearly an intentional decision to shift the focus from cigarette smoking to nicotine exposure. And then, within Life's Essential 8, and I would encourage all your viewers, go to Circulation and find the publication for Life's Essential 8 and just look at the algorithm and the metrics within there. It definitely overstates the risk of e-cigarettes and the risks associated with non-combustible nicotine products. For instance, in Life's Essential 8 for youth, it suggested that youth use of any nicotine product more than 30 days ago carries half the cardiovascular risk as current cigarette smoking among youth. I don't think there's any evidence that would support a claim like that, Yet, like that's how things evolved. A shift from cigarette smoking to nicotine exposure, and then just kind of characterizing nicotine use of any kind as more dangerous, more risky to health than it actually is. So those things happen, and those things certainly contribute to misinformation, and certainly contribute to the misunderstanding among clinicians, among the public, among policymakers regarding these issues.
Dr. Willett, that's a very powerful example. And I think ties in perfectly with the lead and kind of the theme of this piece. And that's that I believe most institutions in society function as a truth-making machine. And it's not to deny that there is the existence of truth, but rather to recognize that truth is often constructed through processes like science, policymaking, and public messaging. And that example you just did is a good example of a shift in truth making and to point in a different direction, and one that's a little bit more wider when it comes to talking about nicotine's harms. So when you look at today's tobacco control organizations and the information they're putting out about safer nicotine products, how truthful really is it?
Well, it's problematic. I mean, without a doubt, it's problematic. That's the reason why I had joined Global Action to End Smoking. I believe Global Action looks at this in an objective, science-based manner. We realize the benefit that will result if clinicians and people who use tobacco and the public and policymakers have a more accurate understanding of nicotine and tobacco products and the relative risk associated with different products. Yeah, that just hasn't been a focus. The predominant tobacco control organizations in the United States haven't acknowledged the continuum of risk and factored it into their strategies, into their messaging, into their policy campaigns, into their interventions in ways that I think they should. I think it was 2015 or around then when Mitch Zeller published a piece in Tobacco Control that called for public health organizations to acknowledge the continuum of risk, that was an essential step. If entities didn't acknowledge the continuum of risk, we would really, we wouldn't make progress toward end game considerations. We wouldn't see as much progress toward realizing a huge public health win. And it's unfortunate that a decade later, we're kind of still in the same position, where organizations aren't acknowledging the continuum of risk and factoring that in, again, to their messaging. A lot of truths, a lot of misstatements that really confuse the issue. So one of my pet peeves is when public health entities claim that tobacco products kill 480,000 Americans a year. I mean, the CDC and the Surgeon General reports have been very clear that cigarette smoking and exposure to secondhand smoke cause 480,000 deaths each year. But there's been just this expansion of the truth, just appending all tobacco products into what we know about cigarette smoking. That's really problematic. It prevents people from understanding that there is a continuum of risk. It makes people believe that every tobacco product is equally harmful. And yeah, those don't benefit public health really in any way.
So I guess it probably comes down to the fact that, again, about youth, is that there's no acceptable tobacco use or nicotine use for youth. So CDC in their recording is always, uses the big bucket, all tobacco use. So smoking can plummet, vaping can plummet, but you toss in, some nicotine pouches and a few other things, and they keep that number up high with the all tobacco use. And so that is like a recording manipulation, in my opinion. But I mean, are they being truthful when the CDC is using a term like that at all category?
I mean, I think that framing is used by a lot of organizations because it benefits advocacy for public policies. It builds support for policies that will, restrict flavor offerings, restrict products, implement tobacco taxes and so on. But they're really not truthful statements. If I could wave a magic wand, I think every publication that looks at the risks associated with tobacco products would have to speak to relative risk, would have to acknowledge relative risk, when it's possible to do so in the study. So with the CDC MMWR that was published a few weeks ago, they were looking at National Health Interview Survey data. And again, that's the survey that showed that there are 7 million fewer exclusive adult cigarette smokers today than there were 6 years ago, and roughly 7 million more exclusive e-cigarette users today. And yeah, the CDC report is focused on all tobacco use and how there's really been no change. While if you look at the data, there's been this incredible transition from the most harmful tobacco product, from the leading preventable cause of death in the United States, to a lower risk product. There was no change whatsoever in dual use. There was no significant change in dual use during that time period, which I think is also really important and could have been more of an emphasis of that MMWR. But the story, the narrative was, tobacco use in the United States unchanged over this time period. When I looked at it and I was like, oh my gosh, this is like a case in point example for how tobacco harm reduction is working in the United States. How do we keep moving forward with that? How do we keep accelerating that reduction in adult cigarette smoking? To achieve the ultimate public health victory, I think, which is eliminating the deaths and disease caused by combustible tobacco use.
So the data is there, you can see it, the CDC can see it, but they refuse to construct the narrative that's accurate to the data. They're clinging still to their old narratives.
They're focused on all tobacco use. Yes, that goes without saying. That was the bottom line takeaway when I read that article. And I published something in Global Action's newsletter specific to this and made that point that, the authors of that MMWR should have celebrated the fact that there was this reduction in cigarette use and put it into the appropriate context. Again, acknowledging the continuum of risk, celebrating the progress that's been made. If they want to be cautionary about that, great. If they want to, speak more about how the increase in e-cigarette use is harmful from a public health perspective, great. But at least, first and foremost, acknowledge that having 7 million fewer exclusive cigarette smokers among adults in the United States is a huge public health success story, and it will only continue. That's also something that kind of surprises me about the position that different entities are taking. It seems to me that the writing is on the wall, right? We know that the vast majority of Americans who smoke cigarettes want to quit. We know that this year alone, more than 10 million Americans will try to quit. It shouldn't be surprising to any of us in public health that they're trying reduced risk products and that they're finding success in helping move away from smoking because they're really motivated to quit smoking. And if these products can help them, of course they're going to use them. So really, I think what we're seeing in the United States is we're seeing tobacco harm reduction in play. We're seeing its success. The success is much more gradual than it needs to be if the health community would acknowledge the continuum of risk, acknowledge the benefits that exist if adults completely transition to these safer products. And honestly, let's help deliver a huge public health victory in the United States. The reduction that we saw over the last 6 years is remarkable. There hasn't been a period in tobacco control where we've seen a reduction of 7 million adult smokers, at least not to my knowledge. So things continue to accelerate. The change, the difference, like what's the different ingredient in the sauce? It's the availability of e-cigarettes. It's the availability of nicotine pouches. It's the availability of these alternative products that, as you said earlier, people are going to, right? That people are making those decisions for themselves, and we shouldn't we shouldn't obstruct them in making those decisions. We shouldn't shame them for making those decisions. We should celebrate that.
So, Dr. Willett, is there now a war on nicotine? Did it shift from tobacco to nicotine?
I mean, clearly the focus has shifted away from cigarette smoking and looking at tobacco products as a category and not clarifying the actual health effects of nicotine. So, I mean, I think in effect, I would say that it is turning into a war against nicotine that I think is to the detriment of the millions of people who could transition to a safer product, to a reduced risk product, and extend their lives by several years. So yeah, it's a dangerous game that's being played right now. As you mentioned in your opening, it used to be a simple message, cigarette smoking kills and nicotine is addictive. If we could just get back to that, that's where we need to be. Cigarette smoking kills. Let's end that. Nicotine is addictive. That's probably its greatest health risk, is that it's addictive. Let's be clear about that. But no, everything's gotten muddled together where now all tobacco products kill. We need to end tobacco product use. We need to end nicotine use. But that's tobacco control. That's not even public health. I see that that's just a misguided effort at this point.
Dr. Willett, talk a little bit more about global action to end smoking. What are some of the plans there to help, fight this battle?
You bet. Global Action to End Smoking is a nonprofit private foundation, and we're really focused on the science, on the evidence, and applying the science and evidence to address misperceptions that exist regarding nicotine. We want to educate clinicians and the public, people who use nicotine, about the continuum of risk that exists and what that means. And really, we want to, the way I like to describe it is we're working to unlock the public health potential of tobacco harm reduction, recognizing the value that it brings to public health, also recognizing that many other public health entities aren't focused on that. We believe that that's an important role that we can play. I think some things that we're working on now that are on the horizon, again, really leaning into addressing misperceptions through what we call our cessation education strategy, which includes work with clinicians. It includes kind of creating more information for people who smoke and want to quit, or people who use nicotine and want more information about those products. So it's really approaching the work as a public health entity that has a value, places a value on harm reduction in the tobacco space.
And another key point, too, I believe, is that GA is involved with funding research, which I think is critical. And certainly with what we've been seeing going on with the Trump administration's moves regarding research funding, that GA is there to help with that.
Absolutely. A lot of our grant making goes to support research. Again, research kind of related to the continuum of risk and what that can mean for public health. So yes, I mean, we would encourage anyone who's interested in learning more about our grants to reach out. We're happy to have those conversations. Anyone whose funding has been impacted by what's happened at NIH or at the federal level, we're always happy to talk. I also recognize that Global Action is able to fund projects on some topics that maybe other organizations wouldn't be interested in funding. So I think we play a unique role in this ecosystem. And during this time where there's kind of a void with what happened at CDC OSH, what's happened at FDA CTP, what's happening with federal funding, we hope we can fill that void in some ways until the dust settles and we recalibrate tobacco control in the United States.
So, Dr. Willett, would you say that your move to Global Action to End Smoking was a radical departure from your past, or simply the next step in your evolving view of what it takes to help people quit smoking?
I mean, I view it very much as a natural step. I want to focus my current work and for as long as it takes on ending the tremendous harm that's caused by combustible tobacco use, combustible cigarettes primarily. It was a natural step for me. I've told folks at Global Action, that a lot of the ideas that I bring here, the American Heart Association kind of had the right of first refusal on some of these, and so I view my current work as work that I'm really passionate about. It's work that I believe in. I don't mind. I don't mind what people think about me, what people think about the transition or the move that I made. I believe that this is important work at this moment in time in the United States. There needs to be more of a focus on adults. And we now have kind of lowest levels of youth nicotine use in many decades. There's been a tremendous reduction in youth e-cigarette use from that peak in 2019. Youth cigarette smoking is almost nil. It's almost non-existent. So it's really time to focus on adults and to create an approach that makes sense. And we know that abstinence-only prohibition approaches don't make sense. They don't work. They create a whole lot of turmoil. We don't need a war against nicotine. We don't need a war against vaping in the United States. And yeah, that war has been being waged now for the last several years. But there's an opportunity again. Hopefully, this is a reset moment where we can think about what is an optimal approach for nicotine and tobacco regulation in the United States that places more of an appreciation for adults and for benefiting adults while we continue to ensure that youth rates remain low.
There's no way that you can look at the U.S. vaping industry in any manner or another and say there's stability, there's a future, and so forth. But yet, it is one of the most effective ways to quit smoking.
Yeah, and I guess I would say I'm a believer in the framework that was established through the Tobacco Control Act for regulating tobacco products. I'm a believer in the pathways that were created for the introduction of new tobacco products. I thought it was a really positive sign that under Matthew Farley and the Office of Science, the Zyn authorizations occurred, and it was the full suite of Zyn products with the full range of flavors. That was a positive step, and I understand we haven't seen that among e-cigarettes. We haven't seen that with the vape products, but I think it was a sign of actions that we need to see more of from the FDA. I mean, certainly we don't have a sensible marketplace whatsoever. The consumer preferences were created during a time where there wasn't federal regulation of e-cigarettes, or during this long, drawn-out PMTA process, where just kind of things were in limbo. And yeah, consumer preferences evolved. And clearly, the range of authorized e-cigarette products is insufficient to meet consumer expectations, to meet what adults are using, what adults prefer. That's from I think, the type of devices, it's the flavors of the products that are available. So yes, if anything, I would say I'm a believer in the framework that was established through the Tobacco Control Act. I'm also a firm believer in the 180-day statutory requirement to complete reviews. I think as the dust settles, at FDA, I hope there's still a commitment to that process, but more so a commitment to the 180-day timeframe. If the reviews were completed within that time period, then the industry and the market can learn from those decisions. We would hope that there would be more products that are authorized that enter the market, that meet the public health standard. So more products that meet the public health standard are available for adults, and that companies, if they submit an application and it fails to meet muster, that there would be a shorter time period for them to get that decision and make adjustments and, make changes to the product and submit a new application. But I completely appreciate, your perspective on the current landscape.
Well, it just seems that nobody in public health, nobody in tobacco control, nobody at the nonprofit, tobacco control groups seem to care at all about what happens to the 18 million Americans who are currently using nicotine vaping products when they bring registry bills in and they start closing down shops and they're banning product. Nobody ever talks about, what could this be doing to the 18 million people that have already quit smoking with it? Not once have I heard anybody talk about that. And I think that's just glaring.
There has to be a harmonization of tobacco control in the United States, a harmonization around the continuum of risk. Even if FDA did its job perfectly, if you have state and local tobacco policies that are counter to the regulatory decisions, right, that are banning flavors, that are banning certain products, that's not a great system. You create inequality with a patchwork of approaches. So yeah, hopefully this moment in time presents a reset opportunity for tobacco control in the United States, where groups can start thinking more about adults, can start viewing this as a more holistic sort of approach, where hopefully we have an effective federal regulatory approach that is enhanced in some way by state and local policies. But yeah, the whole system is out of harmony. It's kind of a mess at this point.
So you support the Tobacco Control Act, and often people say that in it is the mechanism that forced the FDA and the CTP to be so concerned about new users of tobacco products. So that's where they point to, even, one single teenager picks up a vape, well, we can't then abide by flavors, because of course teens love flavors. But yet, though, that's that again, all tobacco use kind of definition. If you were to recognize the continuum of risk, then you'd have to recognize that some teens may end up using some safer nicotine products in the process of making these products available widely for adults. Not only smokers to switch, but for those adults who have switched and are continuing to use nicotine. So how do you parse that? Because it seems that the CTP, at least in its old function, is one that was pretty hardcore on that. A single teen picks up a vape, well, that's it for vaping.
Yeah, I mean, I think the Zyn authorizations are an indication that the CTP was not so rigid with that perspective. For the last several years, the tobacco control community has been trying to paint Zyn as the new jewel, right? All of this just, Zyn has become a cultural phenomenon and the poster child for youth prevention efforts and so on. And in the face of that, and in the face of what they had to know would be strong disapproval from the tobacco control community, CTP moved forward with authorizing all of those products. So I think that's a glimmer of hope in terms of how the CTP could look at the APPH standard going forward. It's not a zero youth scenario, zero youth use being the goal, but it's what is the balance? What is the balance of benefiting adults versus youth who would use the products? And so I completely agree that the full history of the CTP has suggested that zero youth use is kind of the goal, or how they view the public health standard. I think we saw that had shifted. And, again, hope that we can get back to a regulatory process that's moving, where we know the reviews are continuing. Hopefully leadership can ensure that those are happening within 180 days. Hopefully there's more clarity around the public health standard, how the CTP is making those determinations. And I would just say this, final point on this question is that I think that CTP needs to rely on post-market surveillance much more than it has. I mean, it would never be able to complete reviews within 180 days if post-market surveillance is an important part of the equation. So CTP also needs to, be clear about what it would look for in indications whether the public health benefits are actually being realized. So if they're concerned about youth use, what's the threshold where that would be a problem or would become a problem? Let everyone know what that is. So it's certainly not zero use. It's some other number, but none of us know what it is.
Dr. Willett, you've mentioned, of course, that teen smoking in the United States has collapsed. We've done a bunch of stories on that over the last 5 months. And it seems that nobody in tobacco control is celebrating that fact. We had Dr. Ken Warner on the show in January lamenting that very fact. Now, my question is one layer on top of that, and that's, it seems though that should disrupt the concept of gateway, that vaping is a gateway to teen smoking. When you've got no teen smokers left, how can you possibly make that gateway argument? But still yet, many nonprofit public health groups and people in tobacco control are again clinging to the gateway theory. How do we explain that? How do we handle that?
Well, I'm not sure that that many organizations are still clinging on to that fact with the fact that youth smoking rates have plummeted. I'm sure you're right, and I'm sure there are. But I mean, I think it's foolish when you look at the actual data. There's almost no youth cigarette smoking right now. It's at very minimal levels. When you look at daily smoking, it's, I think, 1% or less. I mean, thereabouts. It's a huge public health victory. Again, when I got into this work, 25% of high school students were daily smokers. Now we're like 1% or less. That's a huge public health achievement. Future generations are going to be free. They're going to be free from the deaths and disease that were created by cigarette smoking. That's a huge public health victory. There's no gateway effect. The data would clearly indicate that. I would just reiterate again what I said earlier. There's really not a dual use phenomenon either. The rate of dual use over the last 6 years hasn't changed at all, hasn't changed while we've seen that transition. So I think we need to look at e-cigarettes and these reduced risk products, but e-cigarettes specifically for what they are. They're an appealing alternative for adults. They were very appealing for kids back in 2019, but those rates are significantly lower. And what we have today, we have millions of adult smokers who are quitting, who are transitioning over to a less risky product, and we have a smoking-free generation that should be considered one of the greatest public health achievements over the last 25 years.